Okay. So today I wanted to talk about presenting Medicare to your clients. Okay. I've talked about this before. I don't know if any of you guys have watched the framing video that Roger Short has, but it's in one of the emails that I sent a long time ago. If somebody wants to watch this video, they talk about framing people up into, making them see what you want them to see, right? And one of the things that they talked about was if you confuse people, you're going to lose them. Okay, hold on one second.
That's it. You're done.
Everybody.
So that you can get out of there.
Hold on.
Sorry.
How do I mute everybody? Okay, here we go. Okay, so going back to that framing video from Roger Short, if you guys want to listen to it, I think it's very, very helpful to know like the psychology of the things that you say or the way you say it, right? And one of the things that they mention in that video is if you confuse, you lose. If you give people too many choices, they're just going to be confused and they're not going to know exactly what to do, or they're not going to make a choice, right? The example that he gives is that they said that there was a study of how many people would buy jams depending on how many flavors there were to choose from, right? So on one end of the store, they set up a booth or whatever, a display with 30 different flavors of jams that people can try. And on the other end of the store, they set up a booth where they can try like 3 or 4 flavors, right? And surprisingly, it turns out that on the end where it had all the flavors, there was a lot of tasting, but there was not a lot of buying, right? And on the other end, less choices. There was tasting, of course, but there was more buying. There was less confusion, right? So when I present to my clients, I'm only giving them really 2 options, right? You either get the works, you either get a Medicare supplement with a drug plan, with a cancer policy, and a dental and vision policy. That is option number 1. Or you're going with a Medicare Advantage plan and a cancer policy. That is option number 2. I try to keep it as simple as possible, okay? Premier yesterday, they sent me these handouts, and I thought they were fantastic. And I think it went along the lines of giving less information to not confuse the clients, or just giving them their options so that they can choose an option and not have any other choices. So, for example, this is the Medicare supplement handout that they gave us. And I think I'm going to redo it and put Expert Insurance Team on here and brand it with our logo and whatnot. But it goes over everything. It goes over your Medicare supplements, your drug plans, your cancer policies, heart attack and stroke policies, dental vision, right? And then they give you the opportunity to write in the options for your clients. So if you want to use this and fill it in and hand it out to your clients, you can do that too, right? Step 1, talk about your Medicare costs. We talk about this to the client. We talk about this with the client. What is part A and B and how much it all costs, right? We talk about step 2, adding your Medicare supplement, and we give them their option. I literally only give them one option. A plan G is the most popular option. So just to avoid some confusion, we're going to go with the letter G, Mr. Client, right? And then we talk about their prescription drug plan. And then I talk about dental and vision. And then I talk about the cancer policies. They have the cancer policies here. Well, they have the ancillary policies all in one step, which is step 4, right? So then they have a case design. You can go with example number 1. you go with the works, the supplement, the drug plan, the cancer, the heart attack and stroke, and the dental and vision, or you go with, example number 2, the supplement, the drug plan, the cancer, and the dental and vision, or you go with option number 3, which is supplement, drug plan, dental and vision. You give the client 3 options and no other options. What is this doing? If they go with option number 3, which is the least expensive option, they're still getting an extra policy. They're still getting an extra policy on top of the meat and potatoes of Medicare, the Medicare supplement and your drug plan, and now they're getting an extra dental and vision policy. Because you're presenting it this way. You're giving them no option. You're giving them good, you're giving them better, and you're giving them best. The idea is for us is that we're always selling one supplemental policy or one ancillary policy with every sale. Now, most people are probably going to go with, option number 2. And a lot of people are going to go with the works, but at least the worst thing that can happen is that you're selling one extra policy on top of the meat and potatoes, the supplement and the drug plan. So here's where you can write it in. You write it all in. You say, this is the works, this is good, this is better, and this is best. Which option do you want, Mr. Client? Right? We're framing them up. We're telling them, you only can see this. You only have these 3 options to choose from. Which one do you want to take? And for us, the purpose of doing this is just to not confuse the client, give them their options, make it very clear on what they have to choose from. And every time we sell a policy, the idea is to always sell at least one ancillary policy with everybody we talk to. Does this make sense? You're trying your best to not confuse people by giving them their options. Don't let them think that there are other options out there, right? And at the same time, you're always selling an ancillary policy with every sale. So if you can use this sheet to fill it all in and present it to your client, it's going to help you sell more policies, help you sell more ancillary policies, because it's going to make you talk about these policies as well. Some people, I told you this story before, like when I first started selling ACA policies, I was selling nothing but ACA, 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 ACA. And everybody would say, Carlos, how come you don't sell dental and vision with the policy? Like you're losing money. And I said, well, you know what? You're right. All I have to do is offer it and let them decide whether or not they want it, right? So I started putting it into my repertoire. I started telling them about ACA policies and telling them about the dental policy that they should have with it, because everybody in their situation always wants dental and vision, right? I started selling more dental policies. Not everybody would take it, but at least I gave myself a chance. At least I was presenting it and giving somebody the option to buy it from me, right? Because if I don't present it, I know that for sure I won't sell it. But if I do add it in, at least somebody's going to say yes, right? So I got that all down. I got the ACA policy with the dental and vision. I was selling a lot of those policies. And then somebody said, well, how come you don't sell the accident policies with it to cover somebody's financial exposure for the #1 reason why anybody would meet their deductibles and out of pockets? I said, you know what? You're right. Let me just present it. Let me present the accident policy with the ACA. And guess what? More people started buying accident policies with their ACA and their dental and vision policy. Why? Because I gave myself a chance. I gave myself a chance. I offered it to them and I let them decide whether or not they wanted to purchase it from me, right? So the idea is here, like if you use this worksheet and fill it all in, you're giving yourself a chance to sell these policies, and you're giving the client like no other option. You're framing them up to just choose 1, 2, or 3. Does that make sense? Do any of you guys like give them options? Jesus, are you there?
I'm here.
Brother, what do you do? What kind of options do you give your clients?
With the Medicare sub advantage, I give an option to the hospital indemnity.
So
And
it's always a Medicare Advantage and a hospital indemnity.
always the option is there. You know, whether they buy it or not, then it's up to them, right? But I always given the option.
Right.
And with the ACA, I always offer the dental. I haven't been good at adding the dental and vision because I don't want to take the extra step to go with a different carrier since everything is kind of in one application. But I should. But the dental is the option with the ACA. That's what I do.
Do you ever offer the accident policies with the ACA?
No, I have not.
I think you should. I think you're gonna if you tell the story correctly, if you tell the story the right way, some people are gonna buy it. Like I have an advantage because I had an accident policy myself, and when I present it, I tell my story and people believe in it, right? Because it literally did happen, right? So if you just get my story straight, like when I was selling those accident policies, I hadn't fractured my ankle just yet. But my leader, he had a motorcycle accident, and he explained to me the bills that came through and how he didn't have to pay anything because he had an accident policy. So I was using his story to sell accident policies. And now that I had an accident, incident of my own, I started using my own, right? So everybody should always sell an accident policy if they're selling the ACA policies. Now, the story goes that years ago, I was playing volleyball. I came down on somebody's foot and I fractured my ankle. I went to the urgent care facility. I saw a doctor. They took x-rays and they gave me a temporary cast. And they said, go see the orthopedic specialist on Monday because it happened on a Saturday, right? So I'm telling the story this way because I want them to visualize themselves going to the urgent care themselves, right? I went to the urgent care facility. I saw a doctor. Yes, I'm gonna have to see a doctor when I go there. They took x-rays. Oh yeah, they're gonna have to take x-rays when I get there. They gave me a temporary cast. Oh yeah, they can give temporary cast and stitch you up there at the urgent care facility. I can see that happening to myself too, Carlos, right? Then I tell them, I saw the bill for that urgent care 2 weeks later, it was $1,800, right? So I have a $5,000 deductible plan, 100% co-insurance. So I'm responsible for the $1,800 urgent care facility, right? Bill. I go to the orthopedic specialist on Monday, and it seems like he wants to see me every week. He wants to take x-rays every time I'm there. He gives me a temporary walking boot, and then he says, go see the the physical therapist to get yourself right, right? I'm saying all these things because I want them to visualize themselves going through all this stuff themselves, right? A couple months later, that's a $3,000 bill. So I have a $3,000 plus an $1,800 bill from the urgent care facility, $4,800 that I'm responsible for because I have a $5,000 out of pocket. What did I do? I grabbed all those bills. I grabbed the medical records that said it was an accident, and I turned it into National General, the accident company that we're talking about today, Mr. Client. And guess what? They sent me a check for $4,800 minus the $250 deductible that they say I'm responsible for. And I used that money to pay off all my people. I paid $0 for my accident policy. I don't even remember having to pay the $250 deductible somewhere that the accident policy said I was responsible for. I don't remember even having to pay that. I just grabbed the money and I paid the people off that I owed. So for 25 extra bucks a month, I can cover my whole financial exposure in the event that I have an accident. The number one reason why people would ever get to their out-of-pockets and deductibles. Let's do that instead of getting the more expensive plan that has a lower deductible, lower out-of-pocket that you're never, ever gonna use. Once you give that money to the insurance company, whether you use the insurance or not, you're not going to get that money back. They don't care. So instead of giving that money to them, let's get the most affordable, high deductible ACA policy, and let's supplement it with an accident, or let's supplement it with a cancer, heart attack, and stroke, or let's supplement it with a hospital indemnity plan, whatever your story is, right?
Mhm.
If you start telling that story, I promise you'll make more money with all the ACA policies that you sell. So it's just giving yourself a chance. Give yourself a chance, number one.
Yeah.
And then just tell them that, frame it up as that most people in your situation are going with this bundle, are going with this accident, ACA policy, and dental, vision, and hearing, right?
Yeah, and I think the story is powerful. Like I hear that many times. The stories is what sells.
Yeah, it's all
And if
about
we
the
have a
stories.
story, they put themselves in that situation, and then it's like, yeah, that makes sense.
That's all. And then you say things like, people in your situation. When you say stuff like that, they put themselves in that situation. They're like, oh yeah, that's my situation too, right? Like, without like we learned at 8% with Nate Offert and all that stuff. That the guiding them, the making them think what you want them to think, right? So people in your situation, people like you, oh yeah, people like me go with this, then I should go with this too, right? So I'm going to send this out to everybody. This is the one for the Medicare supplement, and this is the one for the Medicare Advantage plan. At the end of it, they go through the cost of Medicare, your prescriptions, blah, blah, blah. And then they give you the worksheet. Medicare Advantage, hospital indemnity, cancer plan, and a dental, vision, and hearing. This is just one model, right? But if you use this worksheet, you're giving yourself a chance to sell these policies, because now you have to fill this in. Now you have to present this by force if you're going to use this worksheet. I hope this makes sense, right? Lisa, did you have a question? How can we illustrate all of them together side by side? Is that, I'm not sure what you mean, Lisa, but if you wanted to just grab this part of it and use this part of it, you can. Okay. Anybody have any questions about this worksheet?
Where can we get the worksheets?
I'm gonna email it to everybody. Okay. And then if you're wondering how to sell a cancer policy, go back to the cancer training that we did, and you'll learn exactly what everybody needs a cancer policy. They need a cancer policy because if the doctor says you need to try out this experimental treatment, this clinical trial, Medicare is not going to mess around with that. You have to have money to do those things. If you need to go places to get treatment, go to the MD Anderson Cancer Center for a month. Who's going to help you pick up all your stuff? Who's going to help you take support with you? Take your kids out of work to help you, go through your cancer treatment. Medicare is not going to pay for that. You need money for that. And then lastly, oral chemo medications. Oral chemo medications are going to cost you $5,000, $6,000, $7,000 a year. And if the doctor says you need to take these oral chemo medications for the next 2 or 3 years, who's going to help you pay for that? That's where you need a cancer policy. So those are the 3 main reasons why everybody should have a cancer policy. Look back at the video we did, the training we did about cancer, to get more in depth, but it'll help you present this. It'll help you fill this in. Okay.
For the accident insurance, Carol, what did you say that is the #1 reason of what?
So the #1 reason why anybody would meet their deductibles and out-of-pockets when it comes to health insurance is accidents, it's sickness hospitalizations, and it's cancer, heart attack, and stroke. Those are the 1, 2, and 3 reasons why anybody would ever get to their deductibles and out-of-pockets. You're not going to get to your deductibles and out-of-pockets going to get your preventative services every year or going to see the doctor once or twice a year. It's just not going to happen. The only time you're going to get to your deductibles and out-of-pockets is if you have an accident, a sickness hospitalization, or a cancer, heart attack, and stroke. So what are we going to do for you, Mr. Client? What most people do is instead of getting the high premium, lower deductible plan, we go with the low premium, excuse me, instead of going with the high premium, low deductible plan, we're going with the high deductible, low premium plan and throwing on an extra few bucks to cover all of our financial exposure in the event that we have one of those big three: accident, sickness, hospitalization, or a cancer, heart attack, and stroke. Does that make sense?
Mhm.
And I tell the story of, let's say, somebody getting COVID and how much those bills are. You know, that's a sickness hospitalization. I tell my accident story, how it cost me $4,800. It would have cost me $4,800 if I didn't have a $25 accident policy to my health insurance, right? I don't have a cancer, heart attack, and stroke story, but I can make, I mean, I can think of some, you know, just Google it and tell the story. The point is that here we're trying not to confuse people. We're trying to condense their options, tell them what their options are, at the same time, give ourselves a shot by presenting these policies, because some people just don't present the policies. And I was guilty of that when I first started, because I was scared, I was nervous, I was just trying to get policies on the books. I was just trying to sell ACA policies to make a living. But once I realized that I was leaving money on the table by just simply not giving them the option, like I started giving them the option. I don't care if they buy or not. I just want to give myself a shot. I want to be able to shoot the basketball to see if it goes in or not. And I think if you use these worksheets or use something similar to this and fill it in and present it, I think you give yourself a good shot to sell these policies, sell the extra and ancillary policies.
But with this worksheet, we have to separate the appointment to two, right? We cannot do that instantly. Can we do that?
You know what? Like Medicare Supplement and Medicare Advantage?
No, I mean, to prepare this worksheet, we have to get the client's information first, and then we search around, then we present to them.
If you're not fast enough to do it as you go, then yes, you're going to have to, you know, take some time to fill it in. But I would fill it in as we go, right? I would go here. You know, I'm doing a screen share with all my clients and I'm going, you know, plan G with UHC, $120, right?
Mm-hmm.
Then I'm going to go here and I'm just going to copy and paste it twice. You see what I'm saying?
Yes.
And I'm just going to fill it in as we go, because I do it now anyways. If you guys see my presentation, when I let me open up a new window. When I present my when I'm doing a presentation, you guys know that I'm always doing a screen share with my clients, and I'm having this, and I have this window up. And right here, I'm talking to the client. I explain to them how much original Medicare was, and I'm putting it right here. And then I explain to them what a Plan G is, and I put the number right here, right? And then I explain to them what the part, like I'm already doing this just here.
Uh-huh.
If I can switch it up and do it here, maybe it would be easier for them to understand and read, and easier for me to sell the policy, because I'm visually giving them just these three options.
So you mostly, for like a cancer plan, you have a carrier to go, right?
Yeah, my go-to carrier is Mutual of Omaha. It's just the one I've been accustomed to selling. I know how to quote it. I have a good idea of how much it costs for somebody who's turning 65 years old. So that's usually what I'm doing. But Aetna's out there, and there's other cancer policies out there as well.
How about dental vision? You use United Healthcare?
Yes, my go-to is United Healthcare for dental and vision.
Okay,
There's
and
other
how
ones,
about
there's
the accident?
National General, Nat Gen.
Imagine.
Mhm.
Okay.
Okay. Okay, so I'll send these worksheets out to people. Use them if you want. I'm telling you that if you don't have something like this in place already, use it. Give yourself a chance to make more money, and frame the client up. Give them their options and no other options. Don't let them confuse themselves by thinking that there's other options out there. Right? Okay. Mike, are you still with us? Mike.
Sorry about that.
Mike, didn't we go through a scenario this week that we
Oh,
wanted
yes.
to talk about?
Yes, I do.
Okay, so guys, I have a couple of scenarios that I went through this week or past week with other agents. So I wanted to talk about them. Okay.
Sure.
Refresh my memory, Mike. What happened with your people?
Okay, this was a client that I just sold a MAPD plan to him in October for a start date of 1/1/22. And he called me up with a question on a prescription drug that the cost of the prescription doubled from what I had quoted him in Medicare.gov. And actually Medicare.gov and Medicare Center aligned with all his drugs, you know, for whatever reason it aligned. But I followed Carlos's advice and did the Medicare.gov first. So what had happened is, so the client called me up and said his cost was doubled on a prescription that was an eye drops. So I went back with him and I made sure that I had recorded the correct information from the prescription. You know,
Excuse me 1 second. Let me turn off this phone.
Sure.
Sorry about that.
I made sure that the size of the bottle was correct, the amount per day that he used, per time and then per day. And so I did some research before I called up Carlos. I called up Aetna and checked with them on the drug price. And I couldn't find out how it could have doubled because it was, you know, everybody was saying that it was the cost that I had quoted them. So I called up Carlos, gave him the whole scenario. We talked about it for a little bit, did some research, and we found out, and he came up with that the client must have actually doubled. Instead of only getting one bottle, he ended up getting 2 bottles. So that would double the cost. It seemed fairly simple. It seemed fairly simple after Carlos explained it to me.
So the client says, the first thing that comes out of their mouth is like, damn it, what happened? I'm paying too much for my medication. You promised that it would be this amount of money, right?
Correct.
And we check everything and we're like, no, every system is telling us that what we told you is accurate, right? What I tell all my agents that come in, and when something's not matching up, when there's a price here and the system says, when there's a different price than what the system says, the first thing I'm going to tell you guys as an agent is that it's always user error. Don't blame it on the system. Somebody made a mistake. It's either client that made a mistake, has some misinformation, or you made a mistake. You inputted some information or you made a mistake somewhere. It's really not the system, right? So I said, let's figure this out. Like how could this be, right? The system is telling us that the supply that he got should cost this much. Why is he paying this much? Well, could it be possible that that it's not the right, like he got a 2-month supply or a 3-month supply? Let's put it in the system. Let's put it in the system as though he got a 2-month supply. And what do you know? The price for a 2-month supply is exactly the price that he was telling us that he paid for the medication. So now we go back to the client and say, hey man, are you sure you didn't get a 2-month supply? Oh yeah, I got a 2-month supply. Sorry, you know? So like, Just think about that stuff. Like, think about that the system is not wrong. The system isn't wrong. The system usually doesn't make the mistakes. It's usually the client that has misinformation. The dosage is wrong. The quantity is wrong. The weight is wrong. For example, asthma medications can come in, 15.9 grams or 8.7 grams or 6.5 grams, like the weight can be wrong. It can be a capsule versus a tablet. It can be extended release versus not extended release. It can be succinate versus tartrate. Like, all these little thingies can be the misinformation somewhere that somebody doesn't realize. Like my mom, like literally last week, my mom calls me and she says, Carlos, what's up with this metformin? Before, in the past, metformin was $1. Like, why are we paying $200 for this metformin now? I'm like, that doesn't make any sense. Everybody and their mama takes metformin and it costs $3 or $1 or $2. How the hell is this metformin, $200 now? Well, it turns out that the medication she gave me was regular metformin, and now the doctor prescribed her metformin XR. So it's not the same medication. That's why the medication now costs $200. You see what I'm saying? So the system isn't wrong. If my mom would have picked up, the regular metformin, it would have cost her what it showed up on the screen. But there was some misinformation. My mom didn't know that the doctor now prescribed them an XR. Once we knew that, now we understood. Now we can go back to the doctor and say, hey, can you give us the regular one and not the XR?
Mhm.
Okay. That makes sense? So it's user error. It's not the system error. So if something doesn't match up, double check all the information. Double check it. Double check all the information. Right, Jesus? Does that make sense?
It makes a lot of sense, Cabron.
Sometimes the drug's name doesn't match exactly for the end part in Medicare.gov and in Medicare Center. So we can only get the first part right. So for some, has an ER, but in their bottle don't have an ER associated with that.
I'm sorry, I never use the Medicare Center to do the medications, never, because I always go to the Medicare.gov. Maybe it's how I learn, but it's just, then you got too much information everywhere. I just go to the Medicare.gov. That's me.
Yeah, I that's the way I always train everybody is go to Medicare.gov when you're searching for the Medicare Advantage and the prescription drug plans. I understand that Medicare Center allows you to keep the record of the medication and allows you to do a few other things that Medicare.gov won't allow you to do. I'm just saying that you're going to get less mistakes using the mothership, which is Medicare.gov.
Have you experienced any time you putting a medication name, but Medicare.gov doesn't pop up for exactly the same name? Maybe the main part is same, but have some last part like ER, like extended release or something like that.
Yes, I've experienced that. Whatever shows up on the bottle is exactly what you need to find on Medicare.gov. However, sometimes you won't get some extra wording with it, but you just know from experience what it is, because sometimes they'll give you a medication, the name of the medication, and nothing else shows up on the bottle. But on Medicare.gov, it's the name of the medication and then hydrochloride, and then you're confused. You're like, wait, is this the right medication? You'll get used to which ones are the hydrochlorides, are the I don't know, whatever, the little extra after that. But the only way you're going to get it right is by having the client there on the phone with you or on the screen with you while you're plugging in these medications, because you're going to see tartrate and you're going to see succinate, and you're going to ask the client, is there anything after the the metoprolol. Is there anything after the metoprolol? Do you see TART or do you see SUCC? Oh, I see SUCC. Okay, it's succinate, right? Like, always try to build and search your Medicare Advantage and prescription drug plans with the client on the phone, because you're going to ask them the questions: succinate, tartrate, hydrochloride, tablet versus capsule, quantities, quantity, all that stuff. Like, it's just easier to have the client on the phone to build out your stuff, right? Let me show you an example. Hold on one second. Let me show you an example of what not to do, like how to build, how to search for a drug plan when the client's not on the phone and they just give you the information via a text message. Okay, hold on one second. Let me edit this really quick. I want you guys to see something. Hold on.
A picture.
Hold on. Let me just white out this guy's like name and stuff like that.
Carlos, I just have a really quick question.
Yeah.
I've got a client that gets injections at the doctor's office. Of course, those are not showing up in prescription plans. How are those taken care of?
Can anybody answer that question?
What was the question?
I have a client that gets injections at the doctor's office.
Carlos, one time you helped me with this, like the prescription were not showing up on Medicare.gov, and you went to GoodRx, and we found out like it was the healthcare professional really take care of that instead of the prescription.
That's
right. See, I
Yeah,
already know that he's getting the injections from the doctor's office. I'm just wondering if that's covered underneath his supplement or his Part B.
Yeah, so she's trying to answer that, and the fact that it's not covered by your Part D, your prescription drug plan.
Correct.
It's covered by
B.
Part B in Medicare.
Oh,
So-
awesome. Thank you.
So the red, white, and blue, and your Medicare supplement. So
Okay, that's what I thought. I just wanted to double check. Thank
the
you.
general rule, like the general thought is, when you're getting infusion medications like chemotherapy or injections in a hospital setting, like a facility, then that's usually going to go towards Part B. That you can almost bet the mortgage that that's going to be covered by Part B. There are other things like the flu shot or the shingles shot, where that's the shot itself is going to go towards the Part D. But then the physician, the pharmacist, is going to charge you something for administering the shot, right? And that's going to go towards Part B as in boy. Does that make sense?
Mhm.
I hope I didn't
Yes.
confuse you. So the general rule is that if you're getting some sort of injection or infusion medication in a hospital office type of setting, it's going to be under Part B of Medicare.
Okay,
And
thank you.
and any
But, okay, so you just said something that, because I always tell my clients to go to the pharmacist for flu shots or shingles or drugs that are available at the pharmacy, right?
Yeah.
They should go to the pharmacy for that. Otherwise, it might not get covered.
yes.
But now the pharmacist will also charge for the service?
Yeah, I think the pharmacist, if I'm not mistaken, the pharmacist has a charge for like giving you the shot. The medication, the liquid
Mhm,
is going to go in your Part D as in David, your drug plan, but
mhm.
the service is going to be billed to your Part B.
Interesting. Okay.
Seems, Carlos, maybe you need to give us some more instruction about, seems all the shots has a different treatment, like a shingle and a hepatitis. They are different than the flu shot or like a COVID vaccine.
I know what you're saying, and I don't have anything like memorized or anything like that. I just know the only one I know for sure is the shingle shot, because I've had clients ask me about it, and we've gone through it before. The other shots we'd have to figure out what goes where, when, all that stuff.
Yeah, some cover under Part B, some you have to go to pharmacy. Otherwise, if you go to doctor office, it charges you more, something like that. I heard in some more trainings, but I don't remember.
Yeah. So do you guys see the screen right now? You guys see this screen?
Yep.
Mhm.
Okay. So this client gives our agent the medications and tells the agent that he gets his medications once a month, right? He gets a medication and he says, I'm paying more than what you told me it would cost, right? What happened here? Can anybody look at this screen and tell me what the problem is? Remember, the client says, here's my medication. I'm gonna email you my I'm gonna screenshot my medications to you. I get my medications once a month. Tell me how much I'm gonna have to pay for my medications.
This is for 3 months,
Exactly. Why? Where?
90 days
Right here.
quantity. Yeah, 90.
The client doesn't get his stupid medications once a month. He gets his medications every 3 months, right? But the mistake was, number one, we let them send us this information. I mean, although it's helpful, we don't just want to go off of this when we're plugging in the medication. We want the client on the phone and we want to confirm that he's getting a 90-day supply or a 1-month supply. We want to confirm the tablet versus capsule. We want to confirm the dosage. We want to confirm all this stuff while they're on the phone, because we can make the mistake and not notice this and not realize that he's really getting the medication every 3 months as opposed to once a month. Does that make sense?
Yeah, but when we quoting for them, should we use 90 days or 30 days?
Let me tell you what I do, Lisa. I ask them for the name of the medication,
Mhm.
and then I ask them for the dosage, and then I ask them, how many do you take a day? I ask them, how many do you take a day? Once a day, 2 a day? Okay, so that's 2 a day, 60 a month. Do you get quantity 180 every 3 months? That's my next question.
Oh.
So if they are getting it every 3 months, I'm gonna plug it in every 3 months. For newer agents, if you don't want to do all that stuff, then just get the monthly supply, that's fine. But I'm used to asking them, what's the quantity that you get every 3 months? I always say, do you get a 3-month supply or a 1-month supply? And they'll let me know what it is.
How about if we put the 30 piece for a month, 1 a day for 1 month, but if we check use a mail order, it will automatically give us like a mail
3 months.
order with the 3 months prescription, then divided by every month?
Wait. No, if you're gonna quote the mail order, then they're gonna get it every 3 months, right?
Yeah, so
But-
we don't have to ask them, so we can just compare. If you go to pharmacy, then each month, what's the yearly cost, annual cost? Then we use a mail order to compare how much.
No, because mail order is gonna have a different price than walking into the pharmacy every 3 months for your
Yeah,
medicine.
so we can compare, so we can guide the client, say, if you use a mail order, then that will be the price. If
That's
you
right.
use pharmacy, that will be the price.
That's right. That's right. Does this make sense, guys? Like, if you're doing your drug search, you want to make sure that you have the client on the phone. You don't want to have them send you stuff. They can send you pictures, but while you're plugging in, you want to verify the name, the extra little letters that come after the medication, the dosage, the quantity, 1 month versus 3 month supply.
Okay, one more question, Carlos. So when during the quote, if a client say I get every 3 months, so you change the 1 month, the quantity to 3 months quantity for each of them, or?
If they telling me they're getting me every 3 months, yes, I'm doing 90 tablets every 3 months, or 180 tablets every 3 months, or 270 tablets every 3 months.
So for some of the medicine, you can use like a 1 month's quantity, some
Yeah.
use the 3 months. So,
Yeah.
okay, system will figure out all
The
together.
system will tell us how much they're gonna pay every month or every 3 months, depending on how we inputted the information in the system.
Okay, thank you.
Okay, I hope this makes sense. Okay. something very important that we came across this week. And I don't know why I've never mentioned it before. And it was almost a big problem for me about a year ago. So what if somebody is over 65 years old, they have insurance through their employer, and they never got Part B? What do they need to do to get their Part B in place? I'm gonna let somebody else answer. Dave, are you still with me? Gone? Katie, are you there? Nobody's listening?
Can you repeat that, Carlos?
Okay,
Sorry, Carlos, I had my mute on.
that's okay. So the question, Katie, the question is, somebody's over 65 years old, has insurance through their employer. All they did was get Part A. Tell me what they have to do to get their whole Medicare stuff in place so that there's no hiccups.
They have to apply for their Part B, but they will also need a letter from their employer saying that their coverage is dropping.
You got it, right? And then we get them their Medicare supplement and their drug plan or their Medicare Advantage plan, right?
Yep.
What else do they have to do? Or else it will not, or else everything will get blown up. What else do they have to do?
They have to call their
Wait.
employer to stop the coverage.
Okay, yes, but that's not what I'm talking about. What else do they have to do, or else none of this is gonna work?
They have to do within 63 days.
We've already established that. We got everything in place. We got their Part B, we got their supplement, and we got their drug plan in place, or we got their Medicare Advantage plan. We did the applications for that. What is the last thing they have to do?
Hey,
Besides pay, what's the very last thing? What's the very last thing they have to do? Anybody, and I blew my mind after I realized we've never talked about this. Okay,
Activate the policy.
Reina, no, that the policy is going to be activated in the systems,
Uh-huh.
right? Well, forgive me. The Medicare Advantage plan will be fine. If you get them into a Medicare Advantage plan, it will be fine. It's the Medicare supplement area where there's one more step.
You have to give the written application to them to stop it.
Nope. Anybody else? One or two more guesses? Okay.
Carlos?
Katie? Yeah.
Sorry, with the supplement, they're gonna get a call from the company to verify their information. Is that part of this too?
Yes, like let's say we show them proof that we're no longer on the group policy, right?
Right.
Like we get a letter from the employer or something from the insurance company that says our termination date is, this date.
Right. Well, I've had to tell my clients to answer the phone from Mutual of Omaha because they're verifying that their information is correct. And I had somebody not do it, and then they got a letter. So for me, that was kind of that step I forgot to mention to them.
Let's imagine that we did everything right with getting the paperwork, Part A, Part B from the employer and sending it off to Medicare. We got that in place. And let's say we did everything right with the carrier. We got our Medicare supplement in place. They got the documents. They say, okay, your Medicare starts this date. One more step or else it won't work. One more step or else the Medicare supplement will not work. This is what happened to me years ago. I sell somebody a Medicare supplement when they're coming off of a group policy. Months later, they go get service. The bill gets sent off to Medicare, and Medicare says, no, I'm not paying for this. They say, I'm not paying for this because your group policy is still effective. They're primary in our system. In our system, because you didn't tell us that you no longer have group policy, in our system, it shows that the group policy is responsible, not us. So go give this to your group policy. So the last step somebody has to do when they're coming off of a group policy and they're retiring is call 1-800-Medicare and say, listen, I no longer have the group policy. My Medicare will be primary as of this date. If you don't do that, the bills aren't going to be processed correctly because Medicare is still going to think that your group policy is in place.
But if you already tell your employer, they have
Employers that
renew.
employer is going to tell who? Employer doesn't have to tell anybody anything. They just have to stop your policy and that's it.
Huh?
But Medicare doesn't know that you stopped your policy. When you log into your mymedicare.gov and you're still going to show primary insurance, the job insurance.
So everyone need to do that?
Yes.
You already submitted the termination of the group policy.
The termination is going to go to who? It's only going to go.
It's
only
going to go to carrier. It's for Advantage plan.
The L564 form is just going to go to Social Security, and Social Security is going to give you your Part B, and that's it. But Medicare, a whole different department, is still going to show your group policy in place. It happened to me. It happened to me. No one told us that you didn't have a group policy in place, so that's why it's still it's being rejected. The bill is being rejected.
We have to call the Medicare first.
The client has to call 1-800-Medicare and just advise them that as of February 1st, I no longer have my group policy. Original Medicare will be my primary insurance. With Medicare Advantage, you don't have to do that because the Medicare Advantage plan has to go through CMS and it has to get approved by CMS because you can't have a group policy at the same time as having a Medicare Advantage plan. So they double check everything and that's when they'll flip the switch.
But if they have a Part D, they have to go to CMS as well.
You can have a D with the group policy.
But if they apply for Part D as well, then they don't need to call.
No, they have to call if they just apply for Part D. D as in David, because they can have a D and a group policy in place at the same time.
Oh. Oh. I never heard that, so I need to tell each of my clients to do that.
Yeah. Yeah, and forgive me for not bringing it up when we talked about this before. Like it's like something that I made a mistake on before, and it came up again. It came up with somebody this week, and I was like, "Holy snap! I forgot about this. I forgot that you have to call Medicare and let them know that you're no longer on the group policy."
You know, Carlos, now I'm remembering a client that you helped me with. They didn't cancel theirs. And I think we did tell them because she came back and she's like, yeah, my bills were not being paid. But I do remember you telling them. But yeah, but with all the information, it's so easy to overlook.
Yeah, that's like the last step, and I hope nobody forgets now.
There's the form.
When you're coming off of a group policy, you know, well over 65 years old, Medicare sees that group insurance is your primary insurance and Medicare is secondary. And they're not gonna change that unless you tell them to change it.
Yeah, this is the one he already has Part B, so it's a guarantee issue. Yeah. But yeah, they were not getting their bills paid. And then we found out that they didn't cancel.
Mm-hmm.
There's this form L564 that needs to be filled.
That always needs to be filled to get the Part B in place, but that's not going to let Medicare know that you no longer have the group policy. You have to call Medicare and let them know that you no longer have the group policy.
And
We
So
can
that's
have
the case,
kind of
then
call.
you should get the complaints a lot. Then
Yes.
why only why?
Yeah,
Only one.
I don't know. Maybe I'm lucky, or maybe they're doing it on their own.
Carlos,
Yeah,
how about-
I just
how about
said
somebody-
we have the client call themselves.
Yeah, I'm telling you to do that last step. If you haven't got any complaints now, if you haven't gotten complaints yet, hallelujah, we've been lucky. Or maybe the client just doesn't even know, and or maybe they dealt with it on their own, right? The last step is to advise the client to call 1-800-Medicare to tell them, as of this date, we no longer have the policy when you're doing Medicare supplements.
Carlos, how about if they're new to Medicare, but they're still coming off of group?
No, you don't have to do that, because the only time it's going to be stamped in the Medicare system that group is primary is when you delay your Medicare and you continue on with your group insurance.
Oh, okay.
Yeah.
Okay. Thank you.
Did that all make sense? Ooh, I got a lot more, but we're running out of time. It's already.
Hey, Carlos,
Yeah.
that question you had on the hub. There was an issue. Remember, there was a question you had and you're asking for advice. Was that ever answered?
Yes.
What was the answer?
That's it's you can try some tricky ways to get somebody into a Medicare Advantage plan. So the problem was that somebody new to Medicare, January 1, turning 65 in January. We enrolled them into a prescription drug plan, right? When you enroll them into now the client wants a Medicare Advantage plan. They said, oh, I want a Medicare Advantage plan. I don't want to go with the Medicare supplement. The problem is that we're stuck now. There's no way to get it. There's only a few like off the wall ways to get somebody into a Medicare Advantage plan, because you already used the AEP code, the IEP code, excuse me, the initial enrollment period code. You used it up on the Part D prescription drug plan. You can't use the code again when the plan you used it on already became effective. Does that make sense? Like once the plan is effective, that code goes away. So we had to find out, how can we get somebody into a Medicare Advantage plan? We can't use OEP because they're not in a Medicare Advantage plan. OEP only works when they're in a Medicare Advantage plan. So what are other ways? LIS or Medicaid. They don't have LIS or Medicaid. What about a 5-star plan? They don't have a 5-star plan. What about disaster SEP? Well, you can't use the disaster SEP because that only works if you didn't make an election to begin with, right? But now that I think about it, I think you can use the disaster SEP because it stretches for a long time, you know? So I think that this disaster SEP may be the only one that we can use to get them into a Medicare Advantage plan if none of the other SEPs exist. Does that make sense? Like once they choose the PDP, they have to live with the PDP. Almost, it's like it seems like you can't get them into a Medicare Advantage plan. So be careful if you want to explain to them the differences or the options of a Medicare Advantage versus a supplement. Once they pick the supplement, then and the drug plan, they're kind of stuck with it.
Stuck for the year, right?
Stuck for the year until next AEP. That makes sense?
Also, one last question.
Yeah.
One of my clients, I enroll her into supplement and PDP plan, and because she just retired, and we fill in the reason is recently lose employer group coverage, but she still got a letter. The PDP already approved, but she still got a letter to confirm and fill in all the group information.
That's a good thing. Yes, that's 100% normal. It happens every time. So if somebody delayed their Medicare because they have group health insurance and they finally decide they retire, you get all the paperwork together and you sign them up for a prescription drug plan. A month or two later, they're going to get a letter from the insurance company saying, hey, we're going to charge you a late enrollment penalty because we don't know if you had creditable coverage that whole time. So all you have to do is call the phone number, or all they have to do is call the number and attest that they had prior credible coverage. Make sure they give them the dates, and there's no gap between 65 years old and the date they started. And that's it. It'll eliminate the late enrollment penalty. Or fill out that form, put in the dates, send it off, and it'll eliminate the late enrollment penalty. But it happens all the time.
Okay,
That's
that's my
one-
first time I got that, so I was confused.
Yeah, so we have to prep the client on that as well. Like, okay, you're gonna get something in the mail that says that you're gonna owe a late enrollment penalty if you don't tell them that you were covered. So when you get that, call the number over the phone, tell them that you were covered, and hang up the phone, and that's it.
Okay, okay, great, thank you.
Okay. I got a lot of stuff that I'm piling up a lot of stuff that we need to talk about, which is good for me because then I don't run out of stuff to talk about. So we're gonna cut it here unless somebody has something they want to talk about, unless somebody has a question about something. If not, then I'll see you guys next week. I have more stuff, and I'll get that worksheet out to you. I'm gonna try to brand it with Expert Insurance Team, see if I can fix that up. And if you guys need me, you guys know where to find me.
Carlos?
Yes, Katie.
Back in December, or maybe November, we discussed setting up a separate training for those of us that use Radius Bob. Is that still in the works too?
Let's put it on the schedule.
Okay, great.
Let me put it on the schedule so we can do that. Yeah, forgive me. Some of those like things that some people use and some people don't, I don't really like to focus on, but yes, I need to.
Right. No, I mean, a separate training would be fabulous, but I know there's a lot of tools that we use that I still need to really get better at.
Okay. Yeah, let me put it on my to-do list, and then I'll get back to you on that.
Fantastic. Thank you.
Okay.
I have a question, Carlos. Like I am not clear, like with the supplemental plans, maybe the client has Part G, Plan G. Are the deductibles and co-pays not covered for cancer or accident? We were talking about this like a little bit earlier. So are the deductibles are not covered?
No. Forgive me for the confusion. When I was talking about accident policies, sickness, hospitalization policies, cancer, heart attack, and stroke, I was mainly talking about ACA policies. But with Medicare, no, if you have a Medicare and a Medicare supplement.
That's why I was confused.
Yeah, forgive me. Frankly, everything is covered. As long as it's covered by Medicare, it's covered by your Medicare supplement. And all you have to have is $233 in your sock drawer to cover all the expenses.
Sounds good. Thank you.
Okay. Okay, well then, guys, have a good day. Call me if you need me, and I'll talk to you guys later, okay?
Thanks, Carlos.
All right. See ya.
Thank you. Thank you, Carlos.